Point of care blood collection. One of the most frequently performed ones is blood glucose levels. So I want to talk to you about the old method versus VAT's gravity method. VAT applied science to this procedure and it changed it for the better. So whether we're talking about infant heel stick or we're talking about finger sticks. But here I have an example of a resident in a nursing home where a finger stick blood draw was performed. She challenged that the new method really didn't work as well as the old method. So I did the new method first with gravity. Pointed the finger down, allowed gravity to bring blood to the tip. Pricked it and literally watched a nice, beautiful drip and then tube form and took the sample from that. And the result was 221 milligrams per deciliter. Then we flipped the finger over, cleaned it. And since gravity pointed up and held the pad up, gravity was no longer bringing blood to the tip. So now, when pricked and had to squeeze to get the blood up, the new result was 285 milligrams per deciliter. 64-point difference. Same patient, same finger, same sample of blood. So there is a difference. And when you're diagnosing diabetes and you're closer to the 70 to 120 range, and you've got those kinds of disparities, you can misdiagnose. And certainly for those patients who have diabetes and you're trying to titrate the amount of maybe insulin you're giving, or if you're going to put them on one of the PO meds, then 64-point difference makes a difference. And the old squeeze method crushes the tissue. It's sore for 3 days. So use gravity. Who knew? Isaac Newton knew. NASA knew. NASA studied gravity and the effects of it on blood flow in space, the lack of gravity and the effects of it on blood flow in space. So gravity applies definitely here on Earth. You have nothing to lose. The patient has nothing to lose except a sore finger or a sore heel for that infant. So try this new method. And then actually do a test. Research it yourself. See if there's a difference in the actual values. And then hopefully you'll adopt the new VAT method for point of care blood collection. Visit vatmethod.com or the science site STEM21cva.com. STEM, STEM 21cva.com.